So these are some of my favorite pelvic floor stretches and exercises to help relax that area. So come join me. You may want to use, if you have a squatty potty, you could use that. Or yoga blocks, 1, 2 yoga blocks, or a poof or a small stool. And I'll show you what we're going to do with it. If you wanted to use the squatty potty, this is the deep squat exercise that I talked about in the hip and leg video. So if you're having hip and leg pain and discomfort, I suggest that you go watch that video as well. You're just going to sit on your sit bones. That's a lot better. Okay, I can feel that I can relax a little bit more. Let your jaw, shoulders, your breath, your belly, your pelvic floor, and your feet stay relaxed. As you sink into this position, and try and let go in those areas. And that could take some time. You might notice some resistance to that. If you want, you could add some rotation in the thorax while you're there. We have attachments from the diaphragm and the pelvic floor diaphragm. They are the bottom and top part of our inner core, and they're connected through our abdominal muscles, especially the transverse abdominis, the deepest of the abdominal muscles. So they communicate. So when one is tight, the other one is going to be tight. So this can be a nice way to kind of let them communicate together. To say, hey, you're okay. You can let go. Good. And that is a nice one for if you have constipation, trouble having a bowel movement, you can do that one in the morning or whenever to help make that a little easier, and for sure use a squatty potty. Okay, we are going to go on our back. And with this one, you can either have your legs up on an ottoman, a stool, a chair, or you can hold behind your knees, in front of your knees, and just let your pelvic floor relax. Check in with the buddies, the other muscles, jaw muscles, shoulder muscles. Diaphragm is a muscle, your respiratory diaphragm. Your belly, your pelvic floor, and your feet. And if you are someone who likes to be dynamic, you can just allow yourself to rock and let that massage in your hip joints and your low back. Or if you're somebody who just likes to sink into that position and pay attention to the letting go, then do that. You'll feel this in the adductors, the muscles that we did an exercise for in the hip and leg series. And then you're just going to let your feet come to the floor and let your knees fall out. Let's put your right hand on your belly, your left hand on your heart. And let's send some love to these areas. And you may notice when I say that, you might get angry. You might feel guilt. You might be frustrated. You might notice resistance to that. Just notice any emotion or challenge or difficulty in doing that. You might feel like crying. You might be crying, and that's okay. If it feels like too much, you can give yourself a dial and just dial the emotion back to a point where you can just notice sadness there, if that's what it is, or anger, if that's what it is. Again, checking into the jaw. This is where if emotions get high, we can divert our attention to different sensations. If it's too much to stay in the body right now, see if you can hear a sound. I just noticed my fridge go on. I don't know if you heard it. Something external to you. Maybe you open your eyes and you see something that catches your eyes, your attention. And I'm looking up at my plant. Maybe you look around your room. But you keep your hands there because you've probably never sent love to this area before. You notice your jaw, notice your shoulders, notice your breath, notice your belly, your pelvic floor, and your feet. You are safe. You are okay in this moment. And you can bring your hands behind your thighs and pull up. And then we're going to go on our tummy. And this one can either be done flat, if that even is feeling a stretch on your belly. If that's too much, you could put a couple of pillows under your belly. But that's where either adhesions or post-surgically, you want to start to get some mobility. I have a couple of modifications. If you're well into it and you're just doing this for period cramps, for pelvic pain, then you can go either up onto your elbows, up onto your hands. Listen to your body though, not your ego, not where you expect that you should go. Really listen to your body, which is going to be different at different times of the month. Check in with your jaw, your shoulders, your breath, your belly, your pelvis. Relax your bum. I just noticed I was squeezing my bum. Relax your bum and your feet. And this is a really nice one to do if you have back pain as well. So you could be dynamic with it if you just want to come up and back down. This is a nice one when we have back pain, especially if it goes down the leg. You want to centralize that leg pain. So what that means is if it's coming back out of the leg towards the back, even if the back is more sore, that's a good thing. It's more about where the pain is than the intensity of the pain. Always see your healthcare provider though, because this isn't applicable for everyone, and you need to know what you need to do for your specific symptoms. A couple of more breaths. Another one that's nice to do, we'll come up onto our hands and knees. For the pelvis is the adductor stretch for the inner muscles here, which I refer to in the hip and leg video. So if you want to go check that out, it's on that video.